Good evening, greetings from the Institute of Global Professional IGP. Greetings from the Institute of Global Professional IGP. Thank you all for joining us and staying with us till the end. Honorable Knowledge Seeker, today I am your host for the evening. My name is Badhun Dash. I am from Bangladesh. Dear Knowledge Seeker, I am proud to be associated with IGP. IGP is Social and Certified International Educational and Training Institute. In last years, we already served 35 million plus knowledge seekers from 100 plus countries. IGP is internationally recognized and globally accredited. We are connected to more than 450 plus profession and 4,500 plus organization. Institute of Global Professional is an education institute that provides social work globally recognized and reportable. We serve student community resource providing holistic social work and education. We believe that it's not effective to increase one skill just by according formal education. So provide effective training and consultation to generate professional generation all over the world. We distribute our services locally, national, international to student, job seeker, job holder, and also for learner the respective campus location and distance learning platform. We are an occupational and dependable institute. IGP is one of the famous online institutes from all over the world. Our vision is education is not a business product, it's a part of our human rights. Based on our vision, we are trying to reach free webinars, seminar, courses, award, quiz competition, mentoring, and counseling, etc. On the other side, we are also trying to offer more than 100 premium services for free, like Trade on Portfolio website, Resume Builder, Power Letter, Motivation Letter, and Wellness Platform for design journal which can update all day. Kids learning, game, website, free course, commerce sites, and many more. We help to empower you to learn to meet their expectation and dream and become highly skilled people. We implement several training offline online courses for youth learner by professional trainers, speaker, and coaches. Connected by global linear professional to develop all kind of youth and to promote the education of their abilities and personal speaking knowledge is crucial for the state of global professionals. We believe that knowledge is love, light, and vision. So we try to understand the needs of today's generation and we serve them with research and practice method. We work hard for the learner represent more diversity, growth, and innovation and record the latest session with professionalism, passion, and integrity. As you member are committed to offering effective best quality service and content and improve so that individuals who seek information can improve their skill level and value. Before we move to the next, let me remind, don't forget to share, tag, and mention your friend in the comment box. The support is very valuable for us. Thank you. Before we move to the next, let me remind, don't forget to share, tag, and mention your friend in the comment box. The support is very valuable for us. Thank you. Moving to the next, with your continuous support, we already completed 2,183 webinars successfully. Moving to the next, with your continuous support, we already completed 2,183 webinars successfully. Dear IGP speaker, participant, and well-wisher, at this moment, this is a very important message for you all. We change and design our website www.eduigp.com. On this website, we have surprise for everyone. Hope you'll be benefited. We already launched our new website where you can find all our previous activities together with lots of new features. But one strong point is that without an account or login, you cannot enjoy our service. So create your account for once with profile information. Note that with profile information, you'll enjoy all feature with mismatched data. You cannot do anything here. From now on, you have to participate in live quiz competition on our website. We replace slide. You have to join directly on our website. Now you can check all of our previous webinars with verified e-certificate. Now it's easier and time-oriented because after the session, we will not provide any code for certification. You have to take part in one exam for that. If you pass, you will receive your certificate, otherwise not. But you can take part in an exam pass. If you are an IGP speaker, you can download your previous certificate certificate. If you are a host of IGP, you can download certificate of gratitude. If you are an online live quiz competition winner, you can download certificate of participation. If you are selected for lifetime membership, then you can download certificate of lifetime membership easily. Besides this, if you participate in any award function which organized combined support with IGP, you can download that also. You can easily prepare and download 18 types of certificates from our website within a minute. Certificate of Global Professional Membership, Certificate of Global Influence in the Pandemic, Certificate of Active Knowledge Seeker, Certificate of Social Activities in the Pandemic, Certificate of Achievement IGP Knowledge Seeking Campaign 2020, 2021 and 2022, Certificate of Participant Webinar Series 1, Authentic Assessment in Teaching Learning, Certificate of Participant Webinar Series 2, Teaching Foreign Language and Assessment, Certificate of Participant Webinar Series 3, Digital Classroom Engagement Tool, Certificate of Participant Webinar Series 4, the new trend in education, Certificate of Participant Webinar Series 5, Apps Social Leadership and Management Skills, Certificate of Participant Webinar Series 6, Standard Innovation in Mathematics Education, Certificate of Participant Webinar Series 7, Research Comprehension Approach, Certificate of Participant Webinar Series 8. Art and Teaching a Special Program in Art, Certificate of Participant Webinar Series 9, 21st Century Doing Teaching Mathematics, Certificate of IGP Corporate Ambassador, Certificate of IGP Campus Ambassador, which you can prepare and download within a minute. From now on, you can participate in 1,000 plus international level quiz with verified certificate. Teaching tips for teacher, health tips for parents, health tips for teens. Gamification tools for teacher. You can join IGP alumni. You can check out our previous self-help website for free and many more. Dear IGP well-wisher, we promised previously, but lack of technical problem we are late sending on time. This is a good opportunity to collect your previous condition to solve all issues from our website. Now you can enroll, reset password, everything, and check with the for all webinar details. It's a cordial request to check all button and pages on our website. She will accept to benefit it. Thank you, but note that without an account or login, you cannot enjoy our service. At present, we are going to start 2183 webinar, which name is Smart Healthcare System. And today our speaker's name is Dr. Shobhit Ganguly. He is from India. Before this speaker, sir, what share related about him? Assistant Professor, Department of Electrical Instrument Engineering, Kapur Institute of Engineering and Technology. Now, very important moment for me to invite our speaker to IGP with his presentation. Now, very important moment for me to invite our speaker to IGP with his presentation. Hello, sir. Good evening.
Good evening, ma'am. So, can I
Sir,
start?
the stage is yes, sir.
Okay. So, good morning, good afternoon, good evening to all the participants of IGP. We are here now to present a very interesting topic, which will be hopefully going to be implemented in years to come. So we are talking about smart healthcare system. Myself, Dr. Shobhit Ganguly, I'm serving as an assistant professor in the Department of Electrical and Instrumentation Engineering at Thapar Institute of Engineering and Technology, Patiala. So discuss about what are the present challenges with our healthcare system, how we can improve upon what is a smart healthcare system, what are the key components for a smart healthcare system. Then we'll be talking about some of the advantages, the risks and the challenges associated with smart healthcare system, and what are the future trends. So today's topic will be slightly on the technical side, but we'll try to keep it as general as possible. So let me start. What are our present healthcare challenges? We are calling it three. First of all, we are going to discuss about accessibility. So we are having some geographical barriers. Say, for example, some people are residing in the rural areas or the remote locations, in the hilly terrain also. They face challenges in accessing the healthcare facilities due to the lack of availability or limited availability of the healthcare part. Next thing is socio-economic factor. There can be some economic disparities that exist to access the healthcare services. Some healthcare services are too expensive for low-income families as well. So they may be experiencing some barrier with regard to healthcare related to costs. Of course, we have limited smart healthcare infrastructure available in different developing countries as well. So there is still insufficient healthcare facilities, as many countries have seen already during the COVID challenges that the healthcare personnel or healthcare professionals faced with respect to the hospital seats, with respect to the clinics, with respect to the trained persons of COVID-19. So we can contribute that this is one of the major healthcare challenges occurring due to occurring due to geographic locations, occurring due to socio-economic factors, and lack of infrastructure in a particular country as well. So basically, we are calling it accessibility as the major challenge of the present healthcare scenario. Apart from it, the affordability, because few healthcare expenses are really not affordable by lower middle class or even middle class persons as well. Some medications, some medical treatments, some insurance premiums, they are continuing to move up and making your healthcare unaffordable to many individuals and many families. So lack of insurance coverage is also there, lack of awareness or to insurance coverage, as well as lack of insurance coverage to certain individuals may cause a delay in the necessary medical care or health care, due to which some concerns are there. And some of the costs like insurance coverage, some deductibles, some co-payments, co-insurance can cause some financial burdens on the patients as well. So mostly we are talking about affordability issues of smart healthcare, or rather the healthcare, normal healthcare or medication things with respect to insurance aspects as well. Next thing comes your efficiency of your healthcare system. So we are calling it a fragmented healthcare system. That means there are certain fragmentation within our healthcare system, which leads to certain inefficiencies, including some tests which are redundant. There can be some disjointed coordination between the different sections, or rather the different categories. There are some gaps in the information in sharing it to the healthcare providers as well, or healthcare personals as well. So of course these type of challenges are always there, which leads to inefficient system. Administrative burdens are always there. There are some billing issues, coding issues, documentation issues. They consume a lot of time sometimes. And also there are some resources being involved for those healthcare professionals, diverting attention from the patient care. So of course these should not take a smart healthcare management system. So we should have a systematic contributing, or medical errors are there, adverse incidents are also a part. So this can somehow be minimized with the help of a smart healthcare system that we are dealing with today. Now, first of all, let us have a summary of what we understand by a smart healthcare. I think it refers to the integration of the different advanced technologies, and also some data driven approaches to improve the delivery of healthcare services, enhance the patient outcome. So we are trying to optimize also the operational efficiency of the healthcare system. So it is usually involved with some interconnection of devices. Some real-time data analytics are also taking place, and at the same time there is an intelligent automation that is revolutionizing different aspects of the healthcare system, from right from the word go, right from the patient care to the diagnostics, and talking about some of the administrative processes in even. So this is the basic definition of a smart healthcare system. Now let us see some of the next few key components. So the first one which we are offering is electronic health records, which we are commonly calling as EHR. So basically it is a digitized version, it is a centralized version to information of the patients, including the medical history of the patients, the diagnosis, also the medications and the treatment plans as well. So they are providing some information exchange amongst the healthcare providers, improving the care condition coordination, and also maintaining some continuity across different healthcare settings. Say for example, you are going for different treatments, so that your medical history must be there, your diagnostic test which has been conducted, those are preserved in a particular electronic device, in the form of an electronic device, or digitization of the information being kept. So that is basically what we call as electronic health records. Another component which we often came across, we used to hear a lot of terms like telemedicine and remote monitoring of patients when we are into early 2000, 2003, 2005 or something. There was a huge amount of job openings for medical transcriptionists. There were telemedicine practices. Some telemedicine platforms are already being available post-COVID times to facilitate remote consultations. Even I know a few hospitals, they are running some telemedicine app. They are trying to develop a patient care through this telemedicine app, so that remote access or remote access of those facilities can be possible. Video conference with your doctor, you can send a message to a portal, so that whatever phone calls are required, that are also taking place. Some wearable devices are also there. Some home-based sensors are also there. to track your patients or their vital signs or something of that sort, to monitor their health in real time, and providing some proactive interventions and personalized care if it is required. So this can be one of the important options, or one of the important components in a a smart healthcare system: telemedicine and remote monitoring. First aspect is to develop a platform or an app or something of that sort that will provide remote consultation with your doctor and the patient, and through video conferencing it will take place, through messaging it will may take place, it can take place through phone calls as well. And apart from that, when we are talking about remote monitoring technologies, it can be a wearable device for an old person living alone in a home. There can be some home-based sensors as well to detect any signs, to keep track of any of the patient's vital signs and health metrics in real time, and so that it can be intervened before some mishap. Apart from that, once again, talking about wearable devices and Internet of Things, how they are connected, and how we are seeing that there are smart watches trackers being connected to your shoe as well, providing a smart shoe or something of that sort. We can always relate to wearing a smart watch to monitor our health data, including our heart rate, including our activity levels, as well as the sleep pattern. So IoT-based devices are integrated into the healthcare infrastructure so that they enable this remote monitoring, which I was talking about. So these are also interconnected. It's not that they are going in isolation. They are always interconnected. And how we are able to make use of the remote monitoring of the medical equipment or environmental conditions, as well as the patient safety indicators are there, which can improve the efficiency and also improve the patient outcomes as well. So IoT devices and wearable devices can be a part and parcel of our smart healthcare system as well. Apart from that, we cannot deny of a term called AI, or artificial intelligence, in our diagnostics or medical diagnosis. We are having AI powered algorithms which can analyze your medical imaging data. We can have some x-rays, we can have some MRIs, have some pathology based slides to assist the healthcare professionals in diagnosing the diseases, in identifying any abnormality, if any. So we have some term in computer science we call it natural language processing, or NLP, which are vastly used to extract out the insights from the unstructured clinical notes and enabling your faster and more accurate clinical documentation, and also at sometimes decision making as well. So this is another important criteria for moving ahead for smart healthcare system. Another, since we are maintaining a huge set of data, say for example, all the data are available in the form of in a digital form. So obviously, the data analytics must be taken into account. Some big data tools must aggregate and analyze this huge amount of data healthcare, including the clinical records, including any genomic data, including any populations as well. So they will help us to predict modeling, risk stratification, and also identification of the trends and the patterns as well, so that we can proactively prevent any disease or any early intervention of the disease, and also there can be personalized treatment assistance or treatment approaches as well. So this is another key component which we had been talking about, big data analytics. So obviously, when there is an involvement of patient data, so obviously some rules must be there to analyze or to provide some predictive analytics, or provide some predictive modeling, and whether there is any risk associated with any particular trend, whether identifying a particular trend or a pattern, and even some disease prevention can be taken care, some early intervention can be taken, and also it involves a touch of personality as well. So personalized treatment, we are calling it customized treatment, or personalized treatment is a quite common term in the smart healthcare system. Discussing about some of the advantages of these smart healthcare system, So we are having enhanced patient experience. So smart healthcare technologies will improve your patient engagement as well as satisfaction. This will be available through some convenient access to the healthcare services, such as telemedicine consultations can be there, any online appointment can be there, it can be scheduled, some personalized healthcare plans can be there, some proactive health monitoring system can always enhance the patient experience. So what are the other advantages? Improved access to the healthcare system. So telemedicine and remote monitoring we had been talking. So these are providing a breakdown, or rather a breakthrough, I should say, in the geographical barriers, or in remote locations. Somebody staying in the hilly areas, somebody staying in the rural areas, somebody staying in the remote access locations. There can be a chance that he or she is having some internet facility, so that he can talk to some, or he can consult some doctors from there also, and at least get some initial treatment, or at least get some medical care from anywhere with a proper internet connection, but provided the internet connection is available in that particular hilly area or remote area or rural area, whatever we are talking about. Apart from that, when we are talking about mobile health applications, so there are several medical apps which have come up. Even with the hospitals, they have connected with provide some educational resources, as well as some symptom tracking tools as well. uh, I have fever. I am feeling that I am having fever. What may be the possible causes? Based on that, we can suggest some tracking of the symptoms, tracking those symptoms. We can have some medication reminders. We can have the healthcare being managed effectively. So, obviously, the accessibility will, of course, depend upon the internet connection or the mobile health applications, whether an aged person, whether he is able to use it or not. That we have to think also how these health applications or mobile health applications can help in diagnosing any disease, or help in medication reminders as well. Sometimes people have a chance of forgetting to take the medicine, so that reminders are available through this mobile care applications or healthcare applications. Apart from that, when we are talking about some of the advantages of smart healthcare, we talk about cost reduction. Although we are talking about wearable devices, we are talking about medical devices that are integrated with IoT or something of that sort. There are AI tools being used also in the smart healthcare system. Electronic health records are being maintained, so require a huge set of data records to be maintained in the cloud, or in some medical server or something of that sort. So although it involves expensive hospitalizations can drastically be reduced with some stages involved in the preventive care or early intervention of the diseases as well. So leading to less cost with respect to the healthcare, and we can avoid the expensive hospitalizations and the treatments associated with some diseases which are detected in the advanced stages as well. Some monitoring of the chronic diseases also, like diabetes, say for example, post-operative care will also be minimized. There will be less frequent visits, in-person visits, lowering the transportation cost. Suppose, say for example, mm, if I'm having a surgery through robotics or something of that sort. So obviously the in-person interventions or in-person visits are very much nominal. So transportation costs are going to that doctor's place, going to visit that doctor time and again. Expenses can be considerably be reduced. That can be done through remote monitoring or something of that sort. There can be some video conferencing with the referred doctors as well. So this can considerably reduce the cost of the healthcare. Although the devices, the servers, the medical servers can involve some cost as well. So another important is efficient healthcare delivery. So how efficiently we can deliver or can administer any process, any appointment scheduling that can take place, billing that can be taken place with the help of medical documentation, your medical history, everything is being taken care of. So there is a considerable reduction in the paperwork that are involved, the administrative burdens that are there for the healthcare providers. So they can concentrate on the patient care, and rest things will go automatically once you enter the data into the system. That will be recorded and that will be kept in for future purpose as well. So real-time data analytics and modeling, they will also be enabling proactive resource allocation, optimizing staffing levels. Where do we require staff level? We are able to monitor what are the bed capacities, what are the available beds in the hospital, or something of that sort. Inventory management easily with the use of medicine to the patient care as well. Apart from that, when we are talking about empowering our healthcare professionals, so AI driven clinical decisions or support your healthcare professionals who are inexperienced, suppose in diagnosing a disease or recommending some treatment options, or even predicting some outcomes for the patients based on certain evidence based guidelines and medical literature that are available. So AI driven decision making is an important support tool for the healthcare professionals as well. Wearable devices and the IoT sensors, they can provide continuous monitoring of the health parameters, alerting the healthcare teams to potential issues and enabling any early interventions or any timely interventions as well. Apart from that, we are talking about population health management. There is a huge set of data or huge amount of population that has to be managed. We require big data analytics, of course. Whatever big data analytics enable, that will enable your population health management initiatives. You have to identify the high risk patients. You have to track their disease trends and evaluate the effectiveness of the public health interventions as well. So there can be some things like vaccination campaigns should be carried out. Some chronic disease management programs can be taken into account to specific demographic groups based on the data-driven insight. So whatever information we gather about patients, whatever medical history that is available in the cloud server or the medical server, computer server as well. So those data can be easily be used to create analytics, so that whether we require a vaccination campaign, whether we require any chronic disease management that has grown up recently, as we see that most of the people above 40s, they are having diabetes, or they are having issues with respect to blood pressure or something of that sort. So those can be easily be mitigated with the help of smart healthcare records. Now, once a system comes with a lot of advantage, there should be some challenges, there should be some risk associated, because we are having a complete computer server or a cloud based management system, smart healthcare system that we are talking about so far. So there can be some issues because there is a huge amount of information which is digitally stored. So there can be some chances of data security, there can be some chances of privacy as well. So data breaches can be there, unauthorized access can be there, privacy violations can be there with respect to the various platforms, healthcare data platforms. So they are more prone, the digitization and the sharing of the health data across various platforms can certainly increase the risk of data breaches. They can certainly lead to some unauthorized access as well. They can lead to certain violations with respect to privacy as well. So there are certain compliances which has been laid down by Health Insurance Portability and Accountability Act (HIPAA), as well as the General Data Protection Regulation or GDPR. These type of regulations are also coming to safeguard your patient information, but still there is a long way to go. So this is one of the major challenges that we have. Another is a technological barrier. We are making everything automated. We are having completely independent of healthcare professionals or something of that sort. But there is a lot of interoperability issues between the different healthcare systems, between the different medical devices, between the different software platforms that can hinder or that can offend to data exchange and leading to fragmentation as well as inefficiencies. So legally, legacy infrastructure and outdated technology in healthcare organization may pose certain challenges as well to approach the integrated new smart healthcare solutions. Apart from that, we can talk about certain ethical considerations. So we are talking about artificial intelligence to be playing a huge role in the data healthcare decision making. So there are some ethical concerns regarding its transparency, regarding its accountability, regarding its biasness in the algorithms that we are dealing with. So there can be some ethical dilemmas as well, which may lead to some ownership, some consent, some sharing of patient data, or even used for the commercial purposes as well sometimes. So these risks are always there. So some ethical considerations are also a part of the system. This can play also out here in uh, dealing with healthcare professionals as well. Regulatory compliance. So say for example, a medical app provided or suggested certain diagnostic tool. Based on a certain diagnostic tool has given one medicine, and that medicine did not work. So there was no interference of the actual or physical doctor. There was no video conferencing facility available, so they have diagnosed and they have come up with some medicine that did not work well. So there, who should be blamed? Either the platform should be blamed, or your hospital should be blamed, or the healthcare professional who was seeing that might have ignored, or that have. So there has been some compliance with regulations that are coming up, like health information technology for economic and clinical health, that is high tech act. This act is already there. Food and drug administration, FDA act, is also regulating. So there are certain critical issues associated with patient safety as well as legal compliance as well. So these type of things, they keep on happening, so we have to be very much careful regarding this. Some other challenges, say for example, everybody is not well accustomed to technology, use of technologies. Some may not be appreciating the changes that are taking place in. There should be some resistance amongst the healthcare professionals. There should be some resistance to some patients. All of a sudden, I'll say to you, being a doctor, I'll say that a robot will do your surgery, whatever critical surgery you have. You may be having a bypass surgery or something of that sort. So obviously, you are feeling whether that robot will be able to conduct the surgery well enough, or is he or she is well equipped to do the surgery. So things of that sort may, of course, trigger in your mind to adopt and adapt also to the new technologies, and workflows may impede the implementation of the smart healthcare initiatives as well. So there should be a proper training, there should be a proper education, there should be having change management strategies, rather, which are essential to overcome this resistance and provide a culture of innovation and technology adoption in healthcare organizations as well. Talking about quality of care, how much, although we are talking about over reliance of technology and automation, may lead to some personalization of care, but reducing some quality of patient care, or patient provider interactions and holistic patient care or something of that sort. There can be some errors, there can be some inaccuracies with respect to the AI driven diagnostic tools or the treatment recommendations that are provided by AI, which can have serious consequences as well. So some risks are there with respect to the quality, because if you are relying too much on technology rather than human intervention, or you are looking at too much of automation in your healthcare, so there can be chances of having inaccuracies with respect to AI based diagnostic tools, and also the recommendations which those decision making algorithms are making. Now, what should be our future trend? What we are looking ahead? We should discuss about that. We are having some advances in genomics. We are having some molecular diagnostics as well. We are having some precision medicine as well. So we can provide a personalized medicine to the patients, to the individual patients, based on their genetic makeup, based on their lifestyle factors, and based on their medical history as well. Some integration of variable biosensors can be there, which can continuously monitor you, provide some real-time data analytics that will be able to facilitate the personalized interventions or the early detection of several critical and chronic healthcare issues as well. Use of augmented reality or virtual reality in the healthcare system. So we are seeing that a doctor is doing a surgery, or rather he is imitating a surgery, and a robot at a remote location is doing actually the surgery. So these type of surgery planning, this type of simulation based training, this type of medical education will can revolutionize the process, so providing some immersive and interactive learning experience for the healthcare professional as well. So haptic gloves are also there, which can provide the medical therapies, which can which are used for pain management, which are used for rehabs. Some mental health treatments are also done using AI, AR and VR, and also offering non pharmacological alternatives as well, rather than the traditional intervention. So these can are becoming popular and are in research stage, and sometimes in some developed countries they're already being implemented as well. Blockchain is an important issue for preventing your data privacy or data security or interoperability of the healthcare devices, or the healthcare medical equipment or something of that sort. So providing a decentralized or a tamper-proof platform is equally important to store our electronic health records and the medical data. So smart contracts or even decentralized applications can automate the medical healthcare transactions and streamline your insurance claims processing, and facilitate also the security in sharing of information of patients in the healthcare across the healthcare networks as well. So whatever information is available in one medical platform can be shared with another without losing out on data, or whether some data has been taken out and used illegally. So these type of things are already in place. We are having internet of medical things also, which also deals with some devices and sensors for used for patient monitoring, of course personalized health tracking, and also preventive care interventions as well. So some devices like connected insulin pumps or cardiac monitors are there. There are some medication dispensers as well, which will empower the patients to manage chronic conditions as well. So in this way, we can more effectively manage the healthcare practices as well. Of course, we had been talking about artificial intelligence and machine learning applications. So they are used for diagnostics. They are used for predictive analytic models. Also, NLP is being used to assist your healthcare professionals in clinical decision making as well, in detection of any disease or planning of any treatment as well. So ML algorithms, particularly the machine learning algorithms, are used for analyzing large-scale healthcare data sets to identify the pattern of the disease as well, to predict the patient outcome as well, and to optimize the treatment protocols. And this leads to an efficient system or a personalized care, patient care delivery. Of course, when we are talking about the delivery models, so some remote healthcare delivery models, whether we are able to have a telemedicine platform, or we are able to have some virtual care services or a remote monitoring solution to enable decentralized delivery models, reducing the reliance on the traditional healthcare facilities. So home-based rather care initiatives are there, and the mobile health applications are also there to empower the patients to receive some medical consultation, even diagnostic takes, or even some ongoing care, sitting at the comfort of their homes and improving their access and convenience as well. So finally, what we had started with trying to show you a glimpse about the technology interventions to address the existing healthcare challenges, and finally we found that there is an improved patient care experience, there is an enhanced access to the healthcare, and considerable reduction in the cost as well. Apart from that, we talked about few issues like challenges or risk associated with this smart healthcare system in the form of data securities, in the form of technological barriers, or some ethical dilemmas as well. Apart from that, what is there for our future is a personalized medication, a virtual reality platform to do some surgery or remote monitoring surgery as well. And at the same time, we can make use of blockchain in our healthcare system to have the data security to prevent our data being secured, or some insurance related issues can be resolved with the help of this blockchain technology as well. So with this, I wind up today's session on smart healthcare system. So let us go back to the studio and let us see whether what questions I move ahead. Over to you, ma'am, IGP organizers. Please go through the set of queries that the inquisitive speakers can raise, and from where we can also get some solutions.
Thank you so much, sir, for a rich content presentation which can impact our knowledge seeker surely. After your presentation, I hope our knowledge seeker can learn something new, which was our only intention. Learn and grow together, IGP knowledge seeker. Once again, thank you, sir, for your presentation. Now, sir, it's time for our question answer session, which is the one more valuable part of our regular webinar. Honorable sir, please stay with us. After a short video, we will be back in our session part 2, which is the question answer part. Dear IGP knowledge seeker, please ask your question in the comment box as much as you want to know from our speaker. Thank you. After question answer, we have a webinar certification and online quiz competition. Dear IGP knowledge seeker, please ask your question in the comment box as much as you want to know from our speaker. Thank you. After question answer, we have a webinar certification and online quiz competition. Welcome back, sir. Welcome back for our participant. Dear IGP knowledge seeker, please ask your question in the comment box as much as you want to know from our speaker. Thank you. After question answer, we have an online quiz competition. Dear IGP knowledge seeker, please ask your question in the comment box as much as you want to know from our speaker. Thank you. After question answer, we have an online competition. question is from Kingway. Which countries are using the smart healthcare system?
Uh, I think the European nations and mostly the developing countries these days are using some way or the other. Medical apps are a part of our system, healthcare system, as well as in India as well. And using the wearable devices, IoT connectivity is already there. Even US, I think, mostly used for the aged persons. They are using these wearable devices, which were part of your smart healthcare system. They are already being there in US and Canada for almost 10 to 15 years now on. In India, we are having some smart watches or some wearable devices in play, and European nations definitely are using. Some Asian countries are already using it for improved healthcare facilities. Electronic health records are there, and blockchain and all those things for data privacy. They are coming up recently. We are having personalized care, so these type of smart healthcare systems are already in practice as well as in research as well. So most of the countries, most of the developed and the developing countries are using smart healthcare system.
So there is no more questions from our participants. So once again, thank you so much, sir, for your time in IGP. We have learned a lot from you with new topic. It will add some value to our day-to-day activity along with our academic and professional growth. Honorable sir, hope to see you again with a new topic and a new date. Thank you, sir. Take care.
Bye bye.
Honorable sir, before we move to the next, if you want to leave this studio, you can. Dear IGP University, it's time for the online quiz competition. Dear participant, it's time for the most engaging part of this webinar, which is an online quiz competition, which is our regular webinar activity. We change a few process for online quiz competition. Note that after live, no one can participate. Now, time for the online quiz competition. To join the online quiz competition properly, please follow my instruction carefully. Now, time for the online quiz competition. To join the online quiz competition properly, please follow my instruction carefully. Visit www. For some technical problem, we cannot continue the quiz session from our website. So to join the quiz session, you have to go to www.slido.com and the code is 9191980. I repeat the code 9191980. After a short video, we will start our quiz session. With 11 people, we are going to start our quiz session. Our first question is, what is some challenge with smart healthcare? Is it option 1 or option 2? Option 2 is the right answer. 25% people are right here. Our second question is, wearables can be considered smart healthcare device. Is it true or false? Option 2 is the right answer. 93% people are right. Our third question is, these are the importance of a smart healthcare except. Is it option 1 or option 2? Option 2 is the right answer. 80% people are right. Our next question is, how is cloud computing used in a smart healthcare? Is it option 1 or option 2? Option 2 is the right answer. 100% people are right. Our fifth question is, which device does not belong to a smart healthcare? Is it option 1 or option 2? Option 2 is the right answer. 40% people are right. Our sixth question is, cyber security risk is considered a disadvantage of smart healthcare. Is it true or false? Option 1 is the right answer. 80% people are right. Our seventh question is, smart healthcare service reduce the need for physical visit to healthcare services. True or false? Option 1 is the right answer. 93% people are right. Our eighth question is, which of the following is not an advantage of smart healthcare? Is it option 1 or option 2? Option 2 is the right answer. 93% people are right. Our second last question of the session is, smart healthcare use OT, big data, cloud computing, and artificial intelligence. True or false? Option 1 is the right answer. 57% people are right. Our last and final question of the session is, which category is not a smart healthcare service given in the presentation? Is it option 1 or option 2? Option 1 is the right answer. 7% people are right here. Congratulations to our online quiz competition. We are top 10. Congratulations again. We will take a few minutes for finalizing the result. After that, we will issue our online quiz competition certificate on official Facebook page and group instead of Global Professional. Congratulations to our online quiz competition. We are top 10. Congratulations again. We will take a few minutes for finalize the result. After that, we will issue our online quiz competition certificate on official Facebook page and group instead of Global Professional. Congratulations to our online quiz competition in top 10. Congratulations again. We will take a few minutes for finalize the result. After that, we will issue our online quiz competition certificate on official Facebook page and group instead of Global Professional. At the end of our session, we can say properly feed your skill. Never stop learning, cause life never stops teaching us. Be happy and stay safe. See you again and again. We want your participation in every program. If you want to live a happy life, try to a goal on the people or things Albert Einstein. Before I saw hit the button, I can want to thank all IGP knowledge seeker for your active participation as always. See you again in the next session. Thank you.